What if your body has been warning you about diabetes for months, maybe even years, but you've been dismissing every single sign as just getting older? I know you felt it. That weird tingling in your feet you blamed on your shoes. That constant thirst you thought was just the weather. That exhaustion you figured was normal at your age. But here's the truth that nobody wants to tell you. Your body doesn't do anything randomly after 60. Every symptom is a message. And when it comes to diabetes, the messages start long before your doctor hands you that diagnosis. Today, I'm walking you through the 7 silent signs of diabetes that show up after 60. Signs that are so subtle, so easy to ignore, that by the time most people recognize them, their blood sugar has been dangerously high for years. And I'm not just listing symptoms. I'm showing you exactly what each one means, why it happens, and most importantly, what you need to do about it starting today, not next month, not after your next doctor's appointment, but today. Stay until minute 9 because I'm going to tell you about the one sign that 80% of my patients missed completely, even though it was literally staring them in the face every single morning. And when they finally understood what it meant, everything changed. I'm Dr. Nathan Brooks. I've spent over 20 years working with patients navigating diabetes, prediabetes, and metabolic health. And if there's one thing I've learned, it's this. The people who do best aren't the ones who catch diabetes early by accident. They're the ones who knew what to look for. Before we go any further, I need you to do something. Subscribe to this channel right now and turn on the notification bell. I'm not asking because I need the numbers. I'm asking because what I share here every single week is information that can literally change your health trajectory. Real science. No scare tactics. Just the truth delivered in a way that actually makes sense. Hit that subscribe button. It takes 2 seconds. Good. Now let's get into this, because what you're about to learn could be the difference between catching this early and dealing with complications you didn't see coming. Here's what you need to understand about diabetes after 60, and I mean really understand, because without this foundation, the 7 signs I'm about to share won't click the way they need to. When you're younger, let's say in your 30s or 40s, your body has a lot of metabolic resilience. Your pancreas can compensate. Your cells are more responsive to insulin. You can get away with more before your body starts sending distress signals. But after 60, everything changes. Your muscle mass naturally declines, and muscle is one of the most important places your body stores glucose. Less muscle means less storage space, which means higher blood sugar, even if you're eating the same way you always have. Your pancreas, after decades of work, starts to slow down. It doesn't produce insulin as quickly or as efficiently as it used to. Your cells become more resistant to insulin, a process we call insulin resistance, and it happens so gradually that you don't notice it, until suddenly, your fasting blood sugar is a 130 instead of 95, and your doctor is using words like pre-diabetic. And here's the kicker. Type 2 diabetes after 60 is often completely silent for years. No dramatic symptoms, no sudden crisis. Just a slow, steady march toward higher and higher blood sugar levels, while your body quietly suffers damage to your nerves, your blood vessels, your kidneys, and your eyes. That's why these 7 signs matter so much. They're your early warning system. They're your body tapping you on the shoulder saying, hey, we need to pay attention to this before it becomes a much bigger problem. The difference between catching diabetes at the pre-diabetic stage and catching it 5 years later when you already have neuropathy. It's life-changing, literally. So let's talk about what your body is trying to tell you. Sign number 1. You're constantly thirsty and your mouth feels dry no matter how much water you drink. Now I know what you're thinking. Dr. Brooks, I live in a dry climate, or I just don't drink enough water. And sure, that could be true. But here's the difference. Normal thirst is situational. You're thirsty after a workout, after eating something salty, on a hot day. You drink water and the thirst goes away. Diabetes-related thirst is relentless. You drink a full glass of water and 20 minutes later, your mouth feels like sandpaper again. You wake up in the middle of the night desperate for water. You're sipping constantly throughout the day and still feel parched. Why does this happen? When your blood sugar is elevated, your kidneys go into overdrive trying to filter out that excess glucose. To do that, they pull water from your tissues, which makes you urinate more frequently. And all that urination dehydrates you, which triggers that unquenchable thirst. It's a vicious cycle. High blood sugar leads to frequent urination, which leads to dehydration, which leads to constant thirst, which makes you drink more, which makes you urinate more. If you've been chalking up your constant thirst to just needing to hydrate better, but you're already drinking 8 glasses of water a day and still feel thirsty, that's not normal. That's your body waving a red flag. What to do? Don't just drink more water and ignore it. Track how much you're drinking and how often you're urinating over 3 days. If you're drinking more than 10 cups a day and still thirsty, or urinating more than 8 times a day, it's time to check your blood sugar. Sign number 2, you're getting up multiple times every night to use the bathroom. Let me be clear about something. Getting up once during the night to urinate is pretty normal after 60, especially for men dealing with prostate changes or women experiencing pelvic floor shifts. But getting up 2, 3, or 4 times a night? That's not just age. That's a signal. When your blood sugar is consistently elevated above 180 mg/dl, your kidneys can't reabsorb all the glucose being filtered. So it spills into your urine, and where glucose goes, water follows. The medical term is polyuria, which just means excessive urination. But what it feels like is this: your sleep is completely disrupted. You're exhausted during the day. You start limiting fluids after 6 p.m. just to avoid another sleepless night. And you convince yourself it's just your bladder getting older. But your bladder isn't the problem. Your blood sugar is. Here's what one of my patients, Margaret, told me when we finally connected the dots. She's 67, and for almost 2 years, she'd been getting up 3 to 4 times every single night. She was so tired that she stopped going to her book club. She stopped walking with her friends in the morning. She thought she was just falling apart. We checked her fasting blood sugar, 162, her A1C, 7.8%. She'd been living with undiagnosed diabetes for who knows how long, and it was stealing her sleep, her energy, and her quality of life. Within 6 weeks of managing her blood sugar through diet and medication, she was down to getting up once a night. Sometimes not at all. She cried in my office when she told me she'd slept through the night for the first time in 2 years. Sleep matters. And if diabetes is stealing yours, you deserve to know. What to do? Track your nighttime bathroom trips for 1 week. If you're consistently getting up more than once, especially if it's paired with increased thirst, get your fasting blood sugar and A1C checked. Sign number 3, you're exhausted all the time, even when you're getting enough sleep. This one is tricky because fatigue after 60 can be caused by so many things: thyroid issues, anemia, sleep apnea, depression, medication side effects. But diabetes-related fatigue has a specific quality to it. It's not just I'm tired. It's I feel like I'm moving through mud. I have no energy to do the things I used to love. I sleep 8 hours and wake up feeling like I didn't sleep at all. Here's why it happens. Glucose is fuel. Your cells need it for energy. But when you have insulin resistance or your pancreas isn't producing enough insulin, that glucose can't get inside your cells where it's needed. So it just sits in your bloodstream, useless, while your cells are literally starving for energy. You're running on empty, even though your tank is full. Your body has all this available fuel, but it can't access it. On top of that, high blood sugar causes inflammation, disrupts your sleep quality, stresses your organs, and leads to dehydration, all of which compound that bone-deep exhaustion. And because it happens gradually, you adjust. You stop taking the stairs. You skip the activities you used to enjoy. You tell yourself, I'm just getting older. But you're not just getting older, your body is struggling. What to do? If you've been feeling exhausted for more than a month and rest doesn't help, and you can't point to an obvious cause like a new medication or a recent illness, check your blood sugar. Also ask your doctor to check your thyroid and vitamin B12 levels, because sometimes it's a combination of things and you deserve to feel energized again. Sign number 4, your vision gets blurry, but it's not consistent. It comes and goes. A lot of people assume vision changes after 60 are just part of aging. You need reading glasses. You have cataracts. Your eyes are just not what they used to be. And yes, age-related vision changes are real. But diabetes-related vision changes are different. They fluctuate. One day you can read the newspaper just fine. The next day, the words are blurry and you can't figure out why. Your distance vision seems off one week, then fine the next. This happens because high blood sugar causes the lens of your eye to swell. When your blood sugar is elevated, fluid gets pulled into the lens, changing its shape and making it harder for you to focus. When your blood sugar drops back down, the lens returns to normal and your vision clears up. So if your vision seems weirdly inconsistent, especially if it gets worse when you haven't eaten well or when you're stressed, it's not your imagination. It's your blood sugar affecting your eyes in real time. And here's what scares me about this one. If high blood sugar continues unchecked, it doesn't just cause temporary blurriness. It damages the tiny blood vessels in your retina, leading to diabetic retinopathy, which is one of the leading causes of blindness in adults. What to do? If you're experiencing fluctuating vision, don't just update your glasses prescription and call it a day. Get your blood sugar checked. And schedule a comprehensive eye exam with dilation so your eye doctor can look at the health of your retina. Early detection of retinopathy can prevent vision loss. Sign number 5. Cuts, bruises, or sores that take forever to heal. You bump your shin on the coffee table, and 2 weeks later, that bruise is still there, dark and stubborn. You get a small cut on your hand, and it just doesn't seem to close up the way it used to. This is one of those signs people dismiss constantly. I'm just clumsy. My skin is thinner now. I bruise easier than I used to. And while yes, skin does change with age, the speed at which you heal is directly connected to your circulation and your immune function, both of which are impaired by high blood sugar. Here's what's happening inside your body. High blood sugar damages your blood vessels and restricts circulation, especially to your extremities. Less blood flow means less oxygen and fewer nutrients reaching the site of an injury, which slows down the healing process. High blood sugar also impairs your immune system. Your white blood cells, which are responsible for fighting infection and repairing tissue, don't function as well when they're bathed in excess glucose. So your body's natural repair mechanisms are sluggish. And if a wound doesn't heal properly, it becomes an open door for infection. This is why people with uncontrolled diabetes are at such high risk for serious infections, especially in the feet. I had a patient, Robert, who came to me with a blister on his heel that wouldn't heal. He'd had it for 6 weeks. He kept putting bandages on it, thinking it would go away. By the time he came in, it was infected. His blood sugar was 210. He had no idea he was diabetic. We got his blood sugar under control, treated the infection, and within 3 weeks, that wound finally healed. But it could have been so much worse. What to do? Pay attention to how your body heals. If a minor cut or bruise is still there after 2 weeks, or if you notice any sores on your feet that aren't healing, don't wait. Check your blood sugar and see your doctor. Especially watch your feet. Inspect them daily if you're over 60. Sign number 6. Tingling, numbness, or burning sensations in your hands or feet. This is called peripheral neuropathy, and it's one of the most common complications of diabetes. But here's the thing. It can also be one of the earliest signs, showing up even before you've been officially diagnosed. High blood sugar over time damages the tiny nerves in your extremities. It usually starts in your feet and can move up to your legs, or it can affect your hands. It might feel like pins and needles, like your foot fell asleep. Burning or shooting pain, especially at night. Numbness, like you're walking on cotton. Extreme sensitivity, even the weight of a bedsheet feels painful. A lot of people blame it on poor circulation, old shoes, or just getting older. And while circulation issues can contribute, if you're experiencing these sensations regularly, especially in both feet or both hands, that's neurological, not mechanical. The scary part? Once nerve damage progresses too far, it's not reversible. You can stop it from getting worse by controlling your blood sugar, but you can't undo damage that's already been done. That's why catching it early matters so much. What to do? If you're experiencing tingling, numbness, or pain in your hands or feet more than once or twice a week, get your blood sugar checked and ask your doctor about a neuropathy screening. The earlier you catch this, the more you can do to protect your nerves. Sign number 7, and this is the one most people have never even heard of. Dark, velvety patches of skin, usually around your neck, armpits, or groin. This condition is called acanthosis nigricans, and it's a visible marker of insulin resistance. When your body is producing excessive amounts of insulin to try to compensate for high blood sugar, that insulin doesn't just affect your glucose, it also affects your skin cells, causing them to reproduce rapidly. This creates those dark, thick, velvety patches. Most people think it's dirt. I've had patients tell me they scrubbed their neck raw trying to wash it off. But it's not dirt. It's a metabolic signal. And here's what makes this sign so valuable. It often shows up years before your blood sugar gets high enough to be diagnosed as diabetes. It's a warning sign that your body is struggling with insulin resistance right now, in the pre-diabetic stage, when you still have time to reverse it. If you notice these dark patches and you take action, change your diet, increase your activity, lose even 5 to 10% of your body weight, you can actually prevent diabetes from developing. What to do? If you notice dark, velvety patches on your neck, armpits, elbows, knuckles, or groin, take a picture, show your doctor, and ask for a fasting blood sugar and A1C test. This is one of the most actionable early warning signs you can get. Okay, let's talk about what you do if you're sitting here thinking, oh no, I have 3 of these signs, or I've been ignoring that for months. First, don't panic. Recognizing the signs is the hardest part, and you just did that. Now you're ahead of the curve. Step 1. Schedule an appointment with your doctor and ask for these specific tests. Fasting blood sugar, hemoglobin A1C, fasting insulin. This one is often skipped, but it's incredibly valuable for catching insulin resistance early. Step 2. Start tracking. Even before you get your results, start keeping a simple log. What you're eating, how you're feeling after meals, your energy levels, your sleep quality. This gives you and your doctor real data to work with instead of vague memories. Step 3. Make one small change today, not 10 changes. 1. Swap your morning orange juice for a whole orange. Take a 10-minute walk after dinner. Replace white rice with cauliflower rice at one meal. Small, sustainable changes compound over time. And here's the truth I want you to hear. Even if your blood sugar is elevated, even if you get a pre-diabetes or diabetes diagnosis, it's not a life sentence. It's information, and information gives you power. I've seen countless patients reverse pre-diabetes completely. I've seen people with A1Cs of 9% get down to 5.8% through lifestyle changes and the right support. Your body is resilient. It wants to heal. You just have to give it what it needs. Your body has been trying to talk to you, maybe for months, maybe for years. That thirst, that fatigue, those tingling feet, that dark patch on your neck, none of it is random. None of it is just getting older. It's your body asking for help. And the beautiful thing, you're here, you're listening, you're learning. That already puts you miles ahead of where you were 14 minutes ago. I don't want you to live in fear of diabetes. I want you to live empowered, informed, and in control of your health. I want you to look back a year from now and say, that video was the turning point. That's when I stopped ignoring the signs and started taking my health seriously. So here's what I need you to do right now. 1. If you haven't already, subscribe to this channel and turn on notifications. Every single week, I'm breaking down the health information you actually need in a way that makes sense. No fluff. Just real science-backed advice you can use. 2. Give this video a thumbs up if it helped you. That tells YouTube to share this with other people who need to see it. And honestly, this information could change someone's life. 3. Comment below and tell me which of these 7 signs hit home for you. Or if you've already been diagnosed with diabetes, what was your first symptom? I read every single comment, and your story might be exactly what someone else needs to hear. And if you know someone over 60 who's been ignoring these signs, your parent, your spouse, your friend, share this video with them. Sometimes we need someone else to hold up the mirror and say, this matters. You matter. Your body is ready to respond. It's been waiting for you to notice. Now you have, and that changes everything. I'll see you in the next video. Take care of yourself.